Avoidance Blueprint, the cleanest path that works in most situations. Prevention beats appeals every time. The clean path is boring on purpose. Keep continuous qualifying coverage, verify it in writing, and line up here. Medicare start dates before anything ends. Do this, and you'll never see a penalty letter. Here's the simple rule set that works for most people. For medical, either stay on active group health coverage from a large employer, 20-plus employees, or be enrolled in Part B. For drugs, either keep creditable drug coverage in force or be enrolled in a Part D plan. No gaps, no guessing, no penalties. Let me turn that into a checklist you can actually follow. At 64 and a half, start your prep. Ask HR 3 questions in writing. Is my coverage based on active employment? How many employees are there? 20 or more for at least 20 weeks this year? Or last, is our prescription drug coverage creditable for Medicare? Request 2 documents, the CMS L564 Employment Verification Form completed when you retire, and the annual creditable coverage notice for your drug plan. Start a Medicare proof folder and scan everything. At 65, decide your default. If you work for a small employer under 20, enroll in Part A and Part B during your initial enrollment period. Medicare is primary. Add a Part D plan unless you have written proof of creditable drug coverage. If you work for a large employer and want to delay Part B, confirm your plan is primary to Medicare. Keep the creditable drug letter and calendar reminders to repeat this check every fall. In your retirement month, timing is everything. You want your Medicare start date to be the first day after your active employer coverage ends. 90 days before your retirement date, submit your CMS 40B with I want Part B to begin and the exact month, and line up the CMS L564 with HR. For Part D, pick a plan and set the start date to the day after your active drug coverage ends. Don't wait for the annual enrollment period. If your creditable coverage is ending, use your special enrollment period. The thing most people miss is that HR language can be fuzzy. You're covered doesn't tell you if the plan is primary to Medicare or if drugs are creditable this year. Your safety net is written proof. If HR can't or won't fill CMS L564 fast enough, use backups, pay stubs showing health deductions, an ID card with effective dates, explanations of benefits. Social Security accepts those as evidence of active group coverage. Attach them to your CMS 40B and keep copies. Mid-year retirements need a clear timeline. Here's the shortcut. T-minus 90 days. Verify employer size, active status, and creditable drug status. Request CMS L564. Enroll in Part D for the first month after work coverage ends. T-minus 60 days. Submit CMS 40B and include your requested Part B start month. Confirm your Part D plan selection and mail order setup if you use it. T-minus 30 days. Reconfirm end dates with HR, pick a Medigap or Advantage path if you're going that way, and capture all final letters. Day 1 after coverage ends. Confirm Part B and Part D are active. Call the plans if you don't have confirmation. Before we continue, you need to understand the default when you're unsure. If you cannot get timely proof that your employer coverage is active and primary or that your drug coverage is creditable, enroll. Enroll in Part B to stop the Part B penalty risk. Enroll in a low-cost Part D plan to stop the 63-day drug penalty clock. You can always adjust plans later. You can't erase penalty months later. Here's a quick micro story. A client planned to retire in August. HR said, "You're fine until September." That sounded safe, but the drug coverage lost creditable status July 31st. Because we had asked for the letter early, we caught it in June, enrolled her in a $6 Part D plan for August 1st, and saved her a lifetime penalty. The difference was one email asking for creditable in writing. Common mistakes to avoid. waiting to enroll in Part B until COBRA ends, assuming retiree coverage creates a special enrollment period, trusting a verbal we have 20 employees without counting part-timers and seasonal rules, and forgetting that your spouse's employer size, not yours, governs your spousal coverage. The clean path avoids all of that with documents and dates. If you remember nothing else, verify active and creditable in writing, line up Medicare to start the day after your employer coverage ends, and keep proof in a folder. That's the blueprint that quietly saves you thousands for life. Special cases, working past 65, COBRA, retiree plans, and the small employer trap. Let's get precise about edge cases, because this is where good people lose money. Working past 65 sounds simple. Keep your job, keep your insurance, but the details decide whether you can safely delay and whether Medicare or your employer plan pays first. Start with employer size. If your or your spouse's employer has 20 or more employees for at least 20 weeks in the current or prior calendar year, that's a large employer. In that case, the group plan is primary while you're actively working, and you can delay Part B without penalty. When that active coverage ends, you have an 8-month special enrollment period for Part B. That's the safe, clean path. Now, the small employer trap. If the employer has fewer than 20 employees, Medicare is primary at 65. Your group plan is secondary. Delay Part B here, and you're exposed. Claims can be denied or paid, as if Medicare had already paid. You also start building a Part B penalty clock because you don't have a protected reason to delay. The fix is simple. If you're at a small employer, enroll in Part A and Part B during your initial enrollment period so Medicare is in place as primary. Active versus retiree coverage is another critical line. Only coverage based on current, active employment creates a Part B special enrollment period. Retiree coverage does not. It might look identical on your insurance card, but for Medicare timing, it's not the same. If you retire at 65 and keep a retiree plan without enrolling in Part B, you can rack up penalties and get stuck until the general enrollment period. The safer move is to enroll in Part B when you retire unless you're staying on truly active, large employer coverage. Let's talk COBRA. COBRA feels like a cushion, but it does not count as active coverage for Part B. It does not create a Part B special enrollment period. If you take COBRA and delay Part B, you risk penalties and gaps. Even worse, enrolling in Medicare after COBRA starts can cause your COBRA to end. Bottom line, don't use COBRA to delay Part B. If you're retiring, line up Part B to start the day after active coverage ends, and only then consider COBRA for dental/vision or for a spouse's continuation needs. Drug coverage has its own traps. Some retiree and union plans are creditable for Part D. Some aren't. That status can change each year. You must get and keep the annual creditable coverage letter. VA drug coverage is creditable for Part D, and TRICARE for Life generally includes creditable drug coverage, but confirm annually. COBRA drug coverage can be creditable or not. Don't assume. If you lose creditable drug coverage, you have 63 days to enroll in Part D to avoid a lifetime penalty. Don't wait for the fall. Use your special enrollment period immediately. Spousal coverage adds one more wrinkle. If you're on your spouse's plan, the employer size that matters is your spouse's employer, not yours. If your spouse works for a small employer under 20, Medicare is primary for you at 65, even if your own employer is large or you're not working. That's a common coordination gotcha. Ask the spouse's HR directly. Is our plan primary or secondary to Medicare for covered dependents 65 plus? Here's a clean checklist to sort your situation fast. 1. Confirm employer size in writing, 20 or more for at least 20 weeks this year or last. 2. Confirm your status, active employee versus retiree or COBRA. 3. Confirm who's primary. Ask, is our plan primary to Medicare for age 65 employees and spouses? For confirm drug creditable status, get the letter. 5. Line updates. If active coverage ends, Part B must start the next day. Part D must start within 63 days. Microstory to make it stick. A client at a 17-employee firm turned 65 and kept the group plan without Part B because HR said you're fine. Claims started getting reduced because Medicare should have paid first. By the time we fixed it, he owed a permanent 10% Part B penalty, one accurate head count, and a timely Part B application would have saved him every month for life. Common mistakes to avoid: counting contractors as employees without checking how the employer counts for Medicare rules, assuming COBRA buys you time on Part B, thinking retiree plans create a special enrollment period, ignoring spousal employer size, and waiting for the annual enrollment period after losing creditable drug coverage. Each of those choices can turn into lifetime penalties. If you're stuck today, pick the default that stops the bleeding. Enroll in Part B if you can't verify active, large employer primary coverage. Enroll in a low-cost Part D plan if you can't verify creditable drug coverage. Then collect documents. CMS 564 from the employer when possible, pay stubs, plan IDs, and creditable letters to support any penalty reconsideration. Dates, proof, and fast action turn special cases from traps into smooth transitions. Paper trail power, the documents that save you thousands. Here's the shortcut nobody teaches. Your paperwork is your penalty shield. If you can prove you had active group health coverage and creditable drug coverage at the right times, you get smooth special enrollment periods and, if needed, real shots at reconsideration. If you can't, you risk paying for years while you argue. Why proof matters. Social Security needs evidence to grant a Part B special enrollment period and to waive penalties tied to late enrollment. Plans need evidence to remove a Part D late enrollment penalty. Without documents, everyone defaults to penalty applies. With documents, doors open. What to keep specifically? For Part B, keep the CMS 40B, your Medicare Part B application, and the CMS L564, request for employment information. CMS L564 is the gold standard because it confirms your coverage was based on current employment. For Part D, keep every annual creditable coverage notice from your employer, union, VA, or TRICARE. Save plan confirmation letters showing start and end dates for any coverage that counts. Now, how to use them. When you're leaving active employment with a large employer, complete CMS 40B and ask HR to complete CMS L564. On CMS 40B, write, "I want Part B to begin," and list the first month after your active coverage ends. Attach CMS L564 and submit to Social Security. If HR drags, don't stall. Submit CMS 40B and include backup proof. Pay stubs showing health deductions, insurance ID cards with effective dates, explanations of benefits showing claims paid, and an HR email confirming your active coverage and end date. SSA accepts alternative proof when CMS L564 isn't available right away. For Part D, make the creditable letters do the heavy lifting. If a plan ever flags you for a drug penalty and you had creditable coverage, send the letter that covers that exact period. If you don't have the letter, call the former plan or employer and request a written statement confirming creditable status and your coverage dates. Plans are required to provide this. Keep copies of pharmacy ID cards and benefits booklets. While not as strong as the letter, they help. Timing is everything. Request CMS L56460 to 90 days before your retirement date. So HR has runway. Ask for your current year drug creditable letter each fall, and again when you announce retirement. If you're mid-year, get a written end date for both medical and drug coverage. Submit your Part B and Part D enrollments to start the day after those end dates. The goal is zero gaps. Backup strategy if you've lost documents. Rebuild the record. Start with HR. Ask for an employment verification letter and plan participation dates. Pull pay stubs for any month you paid the employer plan. Highlight the deduction. Print plan IDs with effective dates from your portal. Ask the plan for explanations of benefits from the months before you retired to show active coverage. For drugs, contact the plan's benefits office and request a retroactive creditable coverage confirmation. Scan everything to a single PDF and label it Medicare SEP proof. Your name. Common mistakes to avoid. Waiting on HR before you file CMS 40B, tossing the annual creditable letters, assuming a plan will find the data, and mailing originals without keeping copies. Don't do that. Submit copies, keep digital scans, and track delivery. If you fax, keep the confirmation page. If you upload, screenshot the submission confirmation. If you remember nothing else, 2 forms for Part B, CMS, 40B plus CMS, L564, and 1 letter for Part D, your annual creditable coverage notice. Get them early, store them forever, and your Medicare timing stays penalty-proof. If you're already late, damage control and appeal paths. If you're already late, don't freeze. Every uncovered month can increase what you pay, so the first goal is to stop the clock. The cleanest move is to enroll in the earliest window available to you right now. For Part B, that's usually the general enrollment period if you don't qualify for a special enrollment period. For Part D, enroll immediately using the special enrollment period if you recently lost creditable coverage, or the next available enrollment window if you didn't. Let me show you the fast triage. Step 1. Figure out if you qualify for a Part B special enrollment period. Did you have active employer coverage from a large employer that ended within the last 8 months? If yes, you likely have a Part B SEP. File the CMS 40B application and attach proof of active coverage, ideally CMS, L564 from your or your spouse's employer. If HR won't complete CMS, L564 quickly. Submit alternative proof, pay stubs with health deductions, insurance cards with effective dates, or explanations of benefits. The reason this works is Social Security accepts other evidence if the employer form isn't available. If you do not qualify for a Part B SEP, use the general enrollment period. Enroll between January 1st and March 31. Coverage starts the 1st of the next month. That start date matters because it stops additional uncovered months from piling up. Don't wait for a better time. Waiting usually adds penalty months and leaves you exposed for claims. For Part D, ask one question. Did you lose creditable drug coverage within the last 63 days? If yes, that creates a special enrollment period for Part D. Enroll in a plan now. Do not wait for the fall. If you're over 63 days, enroll anyway to stop more months from accruing. You can always appeal the penalty later with proof. You can erase months you keep adding. Now, let's talk reconsiderations and appeals. For Part B penalties, your best path is to enroll first, then submit a penalty reconsideration to Social Security if you had a valid reason or bad information. Strong cases include written employer misadvice that said you could delay Part B, delays outside your control, or administrative errors where forms were mishandled. Attach evidence. Emails from HR, dated letters, pay stubs, and any CMS, L564, you can obtain retroactively. You're asking for reconsideration of the penalty, not permission to keep delaying. Stopping the clock comes first. For Part D penalties, plans must follow Medicare's rules. After you enroll, your plan will notify you if they think a penalty applies. If you disagree, file a late enrollment penalty reconsideration through the plan. The plan forwards it to an independent reviewer. Strong grounds include proof you had creditable drug coverage for all or part of the period, or evidence you received inadequate information about whether coverage was creditable. use the annual creditable letters, employer statements confirming creditable status, and coverage dates. Keep paying the assessed LEP while the appeal is reviewed. If you win, the plan will adjust and refund as applicable. Here's a quick order of operations to stop bleeding and build your case. 1. Enroll in Part B at the first possible window. SEP if eligible, otherwise GP. 2. Enroll in Part D right away. If you lost creditable coverage recently, use that SEP. 3. Assemble documentation, CMS. L564 if possible, alternative proof of active coverage, creditable drug letters, plan IDs, and HR emails confirming dates. 4. Submit reconsiderations, Part B penalty reconsideration to Social Security, Part D LEP reconsideration through your Part D plan. 5. Track everything, dates, receipts, and responses. Common mistakes to avoid right now: waiting for HR to finish CMS, L564 before you file CMS, 40B, assuming COBRA creates a Part B SEP, ignoring the 63-day Part D clock while you research plans, and stopping LEP payments during appeal. Don't do any of that. File, enroll, pay what's due, and build the record. Micro-story to make it concrete. A viewer retired in April, took COBRA, and delayed Part B. By October, claims were bouncing. We enrolled him in Part B during GP, set coverage to begin the next available month, enrolled him in a low-cost Part D plan immediately, then gathered pay stubs and an HR email showing his coverage had been active until retirement. His Part B penalty stuck for 1 full year of delay, but the reconsideration removed 2 disputed months the carrier miscounted. For Part D, the retroactive creditable letter wiped the LEP entirely. The difference was enrolling first and documenting second. If you remember nothing else here, act fast to stop penalty clocks, then appeal with proof. Enroll in Part B at the earliest window you can reach. Enroll in Part D before day 63 if you lost creditable coverage, or as soon as possible if you're past it. Use CMS, 40B plus CMS, L564 or acceptable substitutes, and use your annual creditable letters to challenge any drug penalty. Dates and documents win these fights. The IRMAA connection, how income-based surcharges amplify mistakes. Now we need to layer in IRMAA because this is where small timing errors get multiplied.